Hi all, in this video we will be learning about influenza. Flu is a contagious respiratory illness caused by influenza virus that affects the nose, throat and sometimes the lungs. It can cause mild to severe illness and at times can even lead to death. The best way to prevent flu is by getting a flu vaccine every year. This influenza is a common viral infection that can be deadly, especially in high risk groups. The flu usually attacks the lungs, nose, and throat. Young children, older adults, pregnant women, and people with chronic diseases or weak immune system are at risk. The main symptoms of influenza includes fever, chillness, muscle aches, cough, congestion, running nose. Flu is primarily treated with rest and fluid intake to allow the body to fight the infection on its own. Paracetamol may help cure the symptoms. An annual vaccine can always help prevent the flu and limits its complications. Flu can be reduced by taking rest and drinking plenty of fluids. But if you have a severe infection or higher risk of complications, your health provider may prescribe an antiviral medication to treat the flu. Seasonal influenza is an acute respiratory infection caused by influenza viruses which circulate in all parts of the world. There are four types of influenza virus: type A, B, C, and D. Influenza A virus can further be classified into subtypes called as hemagglutinin and neuraminidase. Influenza B virus are not classified into subtypes, but it can be broken down into small groups. Influenza C virus is detected less frequently and usually causes mild infections. Influenza D virus can also affect the cattle and are not known to infect or cause illness in human beings. The main important signs and symptoms are fever, cough, muscle ache, joint pain, sore throat, and running nose. Most of the people can recover from fever and other symptoms within a week without requiring medical attention. Illness range from mild to severe or even death. Hospitalization and death occur mainly among high-risk groups. The majority of cases of high influenza are clinically diagnosed using a laboratory diagnostic test. Rapid influenza diagnostic test is used in clinical settings, but it have lower sensitivity compared to RT-PCR method. The most effective way to prevent the disease is vaccination. Safe and effective vaccines are available and have been used for more than 60 years. Immunity from vaccination. WHO recommends annual vaccination for pregnant women at any stage of pregnancy, children aged between 6 months to 5 years, elderly individuals aged more than 65 years, individuals with chronic medical conditions, healthcare workers should get annual vaccination. I hope you would have found the video to be useful. If you want to watch more videos of this type, then like, share and subscribe. See you in the next video. Until then, it's bye from Radhika.